Erectile dysfunction is simply the inability to maintain an adequate erection for what you want to do. So for some men, that's not being able to maintain an erection for an appropriate amount of time. For some men, that's not being able to achieve an erection at all. And then for some men, it's not being able to achieve an erection that's as rigid as you want it to be. Erectile dysfunction is incredibly common, especially as men get older. In studies, it's been shown to be present in 40% of men over age 40, and as men get older, it gets even higher. Erectile dysfunction can be caused by a number of things. The most of the time, it's related to vascular changes, so changes in the arteries and veins in the penis, which can happen with aging and with other things like heart disease, high blood pressure, and so forth. There are also a number of different causes of erectile dysfunction, such as pelvic surgery or radiation. So for example, after prostate cancer treatment or treatment for other kind of cancers. Some erectile dysfunction is related to medications like high blood pressure medications. It can be related to hormones, but those are a lot of the main causes. Erectile dysfunction is mainly diagnosed with history, so speaking with a patient, as well as physical exam. In some cases, we do more involved tests like ultrasound of the penis, but mainly it's just that history and physical exam. There are some risk factors for erectile dysfunction that are modifiable, though it's not as easy to say that if you live a healthy life, it can be entirely prevented. Things that can be helpful, though, are eating well, getting exercise, maintaining a healthy weight, and just living a healthy lifestyle, so avoiding smoking and those kinds of things. By seeing a specialist for erectile dysfunction, we can more specifically tailor treatment to you. So we are very well versed in all of the options for erectile dysfunction, what the risks are, the benefits are, how likely they are to benefit you, as well as working up why a man has erectile dysfunction if necessary. Many men will choose to start with oral medications to treat erectile dysfunction. They're pretty affordable nowadays, pretty easy, so a lot of men use those. Sex therapy can be helpful for men who have psychogenic erectile dysfunction or erectile dysfunction is related to like a performance anxiety. Injections directly into the penis can be effective for a lot of men. And penile prosthesis, which is a surgery that we do for erectile dysfunction, is very effective, and a lot of men choose to do that. Other things that we also use are a urethral suppository that goes directly into the urethra. We don't have too many men that use that because it's expensive and not more useful than some of those other options. There's a vacuum erection device, which brings blood into the penis, and then a ring is put at the base of the penis. We don't have too many patients that use that just because it has lower patient satisfaction rates than other things. And then shockwave therapy is one of those things that you hear a lot on the radio and news. It's really still an experimental treatment. And some of what's being marketed isn't actually shockwave therapy. It's a completely different technology that doesn't have any data behind it. So using some of those other options, you just have to be a little bit more careful about or have a good understanding of. We determine which treatment works best for you based on your lifestyle, your concerns, and what you need in your relationship. So for some men, for example, who are traveling a lot, using injections aren't going to be the most reasonable because you have to bring all the needles and an ice cooler and things like that. So we just really tailor it based on your concerns. And for some men as well, some of those options just aren't going to work well. So that is also a factor. Some of the satisfaction rates for treatments of erectile dysfunction do depend on how effective they are for men. So for things like medications, though people who use them are generally pretty happy with using them, however, they're not going to be very effective for a lot of men. So, maybe 50 to 70% of men will find them effective and be satisfied with this. Things like injections, similar story, maybe about 70% of men will be satisfied with them. And then, for example, penile prosthesis, which is effective for most men that try it, if the satisfaction rates are between 92 to 97%, depending on where you ask. With normal erections, the blood fills what are called the corpora cavernosa of the penis or erectile bodies and stretch them out, and that's required to have normal penile health. The long-term consequence mainly of not having erections are when it's not expanding that area regularly, it can scar down to some degree. So some men will have loss of length and girth of the penis with increasing age and increasing erectile dysfunction.